Do you ever encounter patients who are afraid that they won't be able to learn the technique? And what is that about?
The essential answer is yes. What it's about, I guess it depends on the patient. The patients have no problem at all accommodating this. It's rational, it's logical, it's a natural, very natural, above all, natural process that they are taught and guided to use.
If you had to describe in 15 words or less what that part of the mind is, I'll give you 20. What that part of the mind is, for people who are unacquainted with, say, consciousness, and when you say higher consciousness, they're not familiar with that concept. It's something that everyone has, is that correct?
Yes, it's correct.
How would you define that for people who don't know?
The capacity that I refer to, this higher level of intelligence, is innate in all of us. It's not something the person has to learn. The person only has to learn that they have it.
I see.
And learn how to use it.
I see.
When we have an experience, especially an emotional experience, the influence of that experience can be long-lasting, can last for the rest of the person's life. It's a process, really, of conditioning, classic Pavlovian conditioning. And in a state of, especially in a state of intense emotion, what happens, the event, can have especially long-lasting influence. And the influence can be very subtly acquired. We're not aware that we are learning, being conditioned, at the time it happens. Yet in a dark place and we're frightened, we might well learn to associate, even as adults, learn to associate fear and dark. Well, it doesn't make very good sense for someone to be afraid of the dark as an adult. Of course, there are many people who are. They learned that in some situation, at some time, some part of their mind was created in that situation at that time. And that part of their mind is still present. We know it's present because they're still afraid of the dark. Subliminal therapy is a matter of identifying that part and reconditioning that part of the mind.